Sexually transmitted diseases (STIs) versus STDs, often confused. Sexually transmitted infections (STIs) and sexually transmitted diseases (STDs) aren't actually the same thing. An infection, which is when bacteria, viruses, or parasites attack the body, comes before a disease. And while an infection may result in zero symptoms, a disease usually always comes with clear signs. STD symptoms: if an STD starts with a symptomatic STI, you might first experience pain or discomfort during sexual activity or urination, sores, bumps, or rashes on or around the vagina, penis, testicles, anus, buttocks, thighs, or mouth, unusual discharge or bleeding from the penis or vagina, painful or swollen testicles, itchiness in or around the vagina, unexpected periods or bleeding after sexual activity. But remember that not all STIs have symptoms. If an STI progresses to an STD, symptoms can vary. Some of them may be similar to the above, such as pain during sexual activity, pain during urination, and irregular or painful periods. But other symptoms can be quite different and depend on the STD. They can include fever, recurring pain, fatigue, memory loss, changes to vision or hearing, nausea, weight loss, lumps or swellings. Underlying STD causes: all STDs are caused by an STI. These infections are usually transmitted through sexual contact, including through bodily fluids or skin contact via vaginal, oral, and anal sex. Some of them never become a disease, especially if they're treated, and they can even go away on their own. But if the pathogens that caused the infection end up damaging cells in the body and disrupting its functions, an STI will progress to an STD. Types of STDs: while the list of STIs is pretty lengthy, there are fewer STDs. They range from pelvic inflammatory disease, PID, caused by STIs like chlamydia and gonorrhea, to some forms of cancer, caused by human papillomavirus, HPV. Pelvic inflammatory disease, gonorrhea, chlamydia, and trichomoniasis are common STIs that can lead to PID if left untreated. But not all cases of PID are caused by an STI, as other bacterial infections can play a role. Although this infection of the female reproductive organs is classified as a disease, some people have no symptoms. Those who do have symptoms may experience pelvic or lower abdominal pain, pain during penetrative vaginal sex or when urinating, irregular, heavy, or painful vaginal bleeding. Tertiary syphilis: the early stages of syphilis, a relatively uncommon infection, are considered an STI. The infection first appears as one or more small round sores on the genitals, anus, or mouth. If left untreated, syphilis will move to the latent phase, which has no symptom. This disease can have serious consequences for several organ systems in the body, leading to loss of vision, loss of hearing, memory loss, mental health conditions, infections of the brain or spinal cord, heart disease. The earlier syphilis is diagnosed and treated, the less damage it does. Cancer: although some strains of HPV tend to cause no disease, other strains can cause abnormal cell changes. This can lead to cancer, including oral cancer, cervical cancer, vulvar cancer, penile cancer, anal cancer. AIDS: HIV can damage the immune system and increase the risk of contracting other viruses or bacteria and developing certain cancers. With today's treatments, many people with HIV live long, healthy lives. But if left untreated, the virus can lead to AIDS, where the body becomes vulnerable to serious infections and illnesses. People with AIDS may experience rapid weight loss, extreme fatigue, sores, infections, neurologic disorders, cancers. No cure is available for AIDS. And due to the variety of diseases that can be contracted as a result of a severely weakened immune system, life expectancy without treatment is around 3 years. STD diagnosis: it's hard for healthcare professionals to diagnose an STD based on symptoms alone, so they'll need to do some tests and examinations. Depending on the suspected STD, this may involve physical examinations, swabs of bodily fluids, blood tests, specialist procedures, such as keyhole surgery or a colposcopy. STD treatment options: STDs can have varied effects on the body. There are a number of treatment options, depending on the condition, including Antibiotics, other oral or topical medication, surgery, laser. You may also be advised to make lifestyle alterations, such as abstaining from sex until treatment is complete. Remember that, with most STDs, it's not possible to undo any damage that the disease has already caused. And some STDs, such as genital warts and AIDS, aren't curable. Tips for STD prevention: the best way to avoid an STD is to prevent STIs. And the only foolproof way to do that is to avoid sexual contact. But there are ways to make sex safer and reduce the risk of contracting an STI. Have an open discussion about sexual history with a new partner before engaging in any sexual activity, and decide what you're each comfortable with. Get tested regularly for STIs, especially if you have a new partner or multiple partners. Ask any partners to do the same. Use a condom properly during vaginal, anal, and oral sex to help prevent STIs that spread through fluids. Dental dams can also provide protection during oral sex. Consider getting vaccinated for HPV and hepatitis B.